And greetings, YouTube. It's Steve again. Welcome back to my life. So the last time I did my intro video, I explained what I'm going through. So this time I'm going to explain the process of how you go about getting into the knee replacement. And I'll even include the list of equipment you need at home for your post-operative recovery, because I don't think that warrants having a second video. So we'll get right down to it. Everything begins when, if you've got arthritis or whatever, something wrong with your knee or your hip or whatever, and you feel like you need a knee replacement, it all starts with your doctor. Either your rheumatologist if you've got arthritis, or your general physician, your general practitioner physician. It starts there. So what happens there is they send you for x-rays. Yeah, that's me straightening my knee out. They send you for x-rays. The x-rays will come back. X-rays really don't show a lot, but you're still going to be in a lot of pain. So from there, they're going to send you for an ultrasound. The ultrasound is going to show something. So then they have to send you for an MRI. And then they get a really good picture of what they're dealing with. For people who are a little, for a leg MRI, you don't have to go all the way into the machine. They just dip you up to your waist pretty much. And then it's loud as hell. That's the one thing about those machines that always gets me, is even with earplugs in, they're very loud. So be prepared for that. So you do your MRI, you go back to see your GP or your rheumatologist, and they make the determination as to, maybe you should see a surgeon. They might recommend some physiotherapy first. But I've already done physiotherapy for my knee before, and it didn't help because of what's going on. So I did the physiotherapy, and I'd already previously been doing cortisone shots in my knee. So the cortisone was at that point where it was helping, but for limited times. So I seen the surgeon, and the surgeon told me, okay, fine, we can do a knee replacement. By the time I found one that would actually do it, because I've been to more than a couple. And one of them was actually fairly rude about it. Told me flat out, I'm not touching you till you're 65. Now, the pain I was in didn't matter to him. The quality of life I had did not matter to him. And the fact that I was having trouble walking didn't matter. The only thing he cared about was the date on my birth certificate. That was kind of disheartening to see that the doctor didn't care as to my quality of life. He was more interested in just, hey, how old are you? I only want to do this once. He was more interested in the cost associated with doing the operation, as opposed to the cost associated of having somebody wind up on disability, or the cost to somebody who's going to go through this. That's why we pay all the taxes we pay in this country, is for health care. So hey, I'm paying for it. I want to be able to use those services when I need them, right? That's only common sense. So, and I'm not blaming one party over another for that, because they're all equally fucking guilty as far as I'm concerned. Any party that's been in power in this province in the last 25 years, you're fucking guilty of screwing up our health care. There. Here's your little barbed politicians for the day, without it being one-sided in favor of one party or another. I'm blaming them all. I blame every goddamn one of them for screwing up our health care. So, that being said, let's get back to the topic. So you'll go to your surgeon. I found after seeing more than a couple surgeons, one that would do the surgery based on my quality of life. Those are the kind of surgeons you want. So remember that when you're looking for a surgeon, one of the first questions out of your mouth should be to ask, now, do you factor in quality of life, or do you do this solely based on your age? So if you're under 55 years old and they say it's based on your age, you might as well get up and walk out of that office right then and there. Because if they won't do it due to your quality of life, then you're going to get nowhere with them, and they're just going to make you jump through hoop after hoop after hoop. And I firmly believe that it should be based on your quality of life versus your age. Because what's the point of making somebody wait till they're 65? If they're 45 or 40 years old or 50 years old and they need a new knee, and you're going to make them wait 10, 15, 20 years to get it. When I'm 65, fine, I can deal with being in a wheelchair then. I'm not at that point. I'm not ready for that. So I was fortunate. I finally found a doctor who is more concerned with quality of life, because let's face it, if you don't have a quality of life, you don't have life. I've been experiencing that firsthand, and it sucks. It really does. So make sure you ask that question, quality of life versus age. If you don't ask that question, then be prepared for a lot of doctors to just let you down. Because they're so, and I know a lot of them, they're just so afraid of pissing off the government that they're just doing what they're told. That's unfortunate. But yeah, remember, quality of life, ask that question. If they factor quality of life over your age. So I found a surgeon who would do mine. Now, I've been doing some things, like I said, cortisone shots already. So I've been going to a pain management clinic. So that's one of the steps that they might, if you haven't done these things yet, cortisone shot, that's the first thing the surgeon's going to tell you need to try, is doing a cortisone shot or going to a pain management clinic. Now, the cortisone will work. And if you don't have a job where you're on your feet all day like me, it's going to work pretty good for you. Okay, I really can't say that, but different people have different reactions to cortisone. I know people with desk jobs that they're sitting all day and the cortisone, for whatever reason, didn't do anything for them, or at least that's what they say. But I also know people who've got sit-down jobs or they're retired that have had cortisone and it did miracles for them. One of my friends, her dad, was having, he's older than I am, and he had cortisone shots in his knees, and it worked wonders for him. He's retired, so it did wonders for him. But for me, I got mixed results out of it. I did get some relief, but not a lot. So you're going to see the surgeon. They're going to tell you got to do this stuff, and then possibly some physiotherapy. And they're going to tell you have nowadays. They've just changed the rules now, where you have to start doing this physio. They will send you to a physiotherapist. You'll do your 6 weeks there. They'll evaluate you and say, okay, this person's not getting relief from this physiotherapy. I kind of have mixed feelings about that, because there's patients like myself where it's osteoarthritis. It's not going to get any better with physiotherapy. The only thing that's going to work to get rid of that problem is to remove the arthritis, and the only way to do that is to do a total knee replacement. Same thing with rheumatoid arthritis. It just keeps coming back. You can scope out that knee indefinitely, but that will just keep coming back. And that may be another option the surgeon says is, well, we got to scope the knee first. Or, in my case, what happened was, since I'd been taking all these other steps, like getting the cortisone shots, going to pain management clinic, and I'd already done some physiotherapy, they told me I had to try one more thing before they could okay the surgery, which was to get one of these damn things. Now, this, I did get some relief. This is called an unloader brace. And I just want people to be ready for it. you will be told to get a brace. Now this brace, and this is the kicker, it's not meant to be worn 8, 10, 12 hours a day like I have to. And if you have a job like mine where you're on your feet all day like that, this is only going to work for you so long. What this does is, you can see how it's concave on this side. It pushes in, because the problem with me is mainly on the instep. So it pushes over, and most people, your joint is like that. You got a nice space there between your knees. Mine's tipped over to one side because cartilage is degraded. So my knee looks like that instead of like that. Or, you're riding like this. Anyways, you have a nice even gap in your knee, and mine's tilted to one side. That's where this comes in. It puts pressure on the side of the knee. It forces that femur over a little bit to open up that gap. Well, given my job and everything, this isn't working anymore, and I'm just getting massive swelling, so that sent me back to the surgeon after a year and change. So, end result, we're into doing the knee replacement. So, he okayed the knee replacement. And the old process for doing any kind of surgeries and stuff, because I've had a rotator cuff repair in the past. It used to be they set your surgery date like 6-8 months from the date you saw the surgeon to get the okay. Nowadays, it's maybe a couple of months, tops. I got the okay for surgery on February, I think it was February 1st, and my surgery date is March 19th. So just over a month and a half. And I think the longest I've heard people waiting now is the newer system for surgery has cut down the wait times quite a bit. So what happens now is you're going to find it's an accelerated process. So be ready for every week going to see at least one different doctor for a few weeks, or even 2 doctors a week. The first thing you're going to do is they're going to send you to an educational seminar at your hospital. Now, when you see your surgeon, you're going to pick up your packet. You're going to pick up a packet. It's going to be in a big old white envelope. Just bear with me here. You're going to get that. You're going to get a package. It's going to have information on the front of it. It has your hospital name. It's called a preoperative planning program. Your doctor's name on there, type of surgery you're having, the date of the procedure, and then it's got all the forms in there. It's got a history and physical to be completed by your family doctor, a pre and anesthetic questionnaire front and back, and a registration form for the hospital so they know where to stick you. And inside that package, it gives you this nifty little piece of paper, my total joint replacement passport. It's essentially a checklist. You write down your date of surgery, your appointment with your family doctor, meds check, pre-op appointments, estimated discharge date, appointments with specialists, joint education class, and you write in whether or not, yes, you check off you got your recommended equipment prior to your admission to the hospital, and transportation arranged for discharge. Now, by equipment, they mean, and I was going to make a separate video on this stuff, there is one piece of equipment I'll probably make a separate video for, because I don't want to go too long on this one, and it's a cryo pump. This one's called a Cold Rush. What it is a pump that you fill up with ice and water, and it pumps cold water around a bladder that you velcros to your joint. So in my case, it's a knee. It'll pump water through tubes into a bladder that surrounds your knee joint. Helps with the swelling after surgery. So, and the equipment that they want you to have, you need a commode for your toilet so that it raises you about 6 inches off the, about 6 to 8 inches off the toilet. They want you to have a bath seat or a bench for your tub or shower. If you've got a stand-up shower, benches work great. They want you to have a walker, some crutches, and one of those. They also give, and then they give you your appointments here on the front. One of them is your educational classes. Well, that's what this is. You get this whole handy-dandy booklet as part of your new knee. And it's got the whole introduction, learning about knee replacement, getting ready for surgery, after surgery, hospital stay, going home, preparing your home, equipment, healthcare, team members. So you go into this class, and the first person that's going to speak to you is going to be a nurse. And she runs you through what actually goes down in the surgery. And you speak to a pharmacist. Well, it's a pharmacist. He comes in and addresses the class. So the pharmacist comes in, he gives you a breakdown. What drugs that you're going to be put on before you have your surgery. They're going to give you a shot, and they're going to give you antibiotics, they're going to give you muscle relaxants, the kind of anesthesia they're going to give you. They give you that breakdown. And then he gives you a breakdown on, they've got, you're going to have anticoagulants administered after the surgery, as well as pain relief medications, like morphine pump or oral pain relief. Then after that, they have the physiotherapists come in, and they talk to you about in-hospital physiotherapy, and final stage is the home care physiotherapy. They also tell you how to, common sense items. If you got area rugs, like right by your door, take them up, because you're going to be using your walker for the first couple of days, and the last thing you want to do is go ass over tea kettle. So just common sense things like that. Make sure you've got walkways through your apartment. The only thing I got left to do is push my coffee table out of the way. I've got it all ready to go. And the only thing I'm waiting for is the day of my release from the hospital. My friends will be bringing over my bathtub seat, and I'm good to go then. So I'll have that for when I get home. And one part of the package they give you is this little thing. It's called a Solu Prep Antiseptic Skin Cleanser. So part of the rundown that they give you, that the nurse tells you about, is when you're, the day before your surgery, you're going to take a shower the night before. You wash down with soap and water, no perfumes or colognes in your soap. But and after you do that, then you go, since my case it's a knee replacement, I'll wash from toes to my hip with this thing. And this essentially just kills all the bugs. So you go into the hospital. So then after that appointment, I went to see an internist. They did an ECG, which is your little beep, 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 flatline. Yeah. You go see an internist. They do an ECG. They do your blood pressure, your heart rate. They check your chest sounds. Make sure you're not going to die on the table. And they ask you about your medications, and they'll advise you if they need you to stop medications beforehand. In my case, I have to stop all but one of my medications, just because two of them are immunosuppressants, and one of them is a blood thinner. So they don't want me getting a mass infection, and they don't want me bleeding out on the table. So you're going to do that appointment. And then from there, you're going to have your appointment with your GP to fill out the physical questionnaire, because you have to do a physical with your general practitioner. And from there, you're going to have to go, the next set of appointments you're going to have is in the hospital. It's a 4-step process. First, you see the nurse. From the nurse, then you're going to go see, who do you see next? You see the girls in the lab. They do your blood work. They take another ECG, x-rays, and all that good stuff. Heart rate, blood pressure, all that good stuff there. Well, the x-rays is actually a separate step, but I kind of just cobble that together. So one set of people are doing your blood work and your EKG and your blood pressure and heart rate. Then you jump over to the third step, which is your x-rays, and then last you're going to go talk to your anesthetist, and they're going to ask you about whether or not you've had reactions to anesthesia before. Myself personally, I'm preferring not to go to sleep this time, mainly because I have no brain-mouth filter when I come out of general anesthetic. I don't need another embarrassing moment like what happened with my shoulder operation. I don't know who was more embarrassed, me or the nurse. Probably me, when I realized what I said to. It wasn't anything bad or nothing. It was just kind of stupid things people say when they're out of it on drugs. But then realizing I said something that stupid was just very embarrassing. So yeah, you're going to go see your anesthetist. They're going to explain your options to you. Besides the fact I don't want to go under, because the recovery time is way faster for people who don't have to be put to sleep. Plus, I can watch some TV. Yeah. And I'm pretty sure that now surgeons are leaning towards them not wanting to put you under if they don't have to. When they do the spinal anesthesia, what they do is they put in a neural block. So it blocks sensory and the motor control nerves. So your legs are limp like a noodle. You don't feel it. You can't move it. It's gold. Everybody I talk to that's had it, they've got no complaints about it. So I'll let you know how that works out for me. So after you have that appointment, your next appointment is going to be after you've done your 3-4 hours at the hospital. Mine took me just over 3 hours, I think 3 hours and 10 minutes. It was in and out pretty quick. After you do that, you're going to go back to see your surgeon. You're going to do one final check on you, just ask you a bunch of questions. Like I stated earlier, do as much reading on the process as you can. Watch videos if you can. Educate yourself on the process. It really does pay off. It helps. I'm sorry about the length of the video here, but like I said, I didn't want to do a separate equipment video. I don't even, come to think of it, I don't think I really need to do a video on the cryo pump. I think I explained it well enough. It's a small unit. It's probably about 18 inches long. It sits on. It's about the size of a decent sized humidifier, and it just wraps around your knee. So I hope I've shed some light on it for people. And sorry I went off on a couple little tangents there, but that's the way I feel about the system right now. Like I said, I hope this helps some people, and it's more than just me therapeutically talking to the camera to reassure myself here. I mean, I have some fears going into the surgery. That's natural. You wouldn't be human if you did. But I'll be honest, I'm looking forward to having it done so that I get relief from this, because it's way overdue. Like I said, I'll try to get some video from in the hospital. I don't know if I'm going to be able to upload from there, but hey, hopefully we can. Anyways, if you have any questions, comments, let me know in the comments section. Like I said at the opening, I'm going to post links to 3 different videos. If you're squeamish, watch the first one, because that's a CGI. There's no blood at all. The other 2 are both going to have some blood in them, so hopefully I don't get the YouTube ban hammer on me for that. But I'm just trying to help people get educated as to the process, so you can see what it is. You can see what the people who are having this go through, if you know somebody who's going to go through this, and you know what to expect for yourself if you are unfortunately having to have this. Is it's not pleasant having to have it, because if you're in that position, you've suffered enough already. Okay? So anyways, everybody, take care. I hope you guys are all having a great day today, and I will see you in the comment section. Till then, peace out, folks.